This medication is a combination of vitamins and fluoride. It is used in infants and children to treat or prevent deficiency due to poor diet or low levels of fluoride in drinking water and other sources. Vitamins are important building blocks of the body and help keep you in good health. Fluoride is used to prevent dental cavities. It is important to take this medication as directed by your doctor. The recommended dosage will depend on your age, medical condition, and response to treatment. It is usually taken once daily with a full glass of water, preferably at bedtime or after brushing your teeth. Make sure to follow your doctor's instructions for the best results. When taking Quflora, it's usually recommended to take it once a day. Try to take it at least 2 hours before or after consuming any products containing calcium or aluminum/magnesium hydroxide, as these can decrease its effectiveness. Some brands of Quflora should be shaken well before each dose. Check the specific instructions on your manufacturer's bottle. Use the provided medicine dropper to measure the dose carefully. You can swallow the drops directly, add them to a small amount of liquid, or mix them with a small amount of food like applesauce. The fluoride in Quflora can be absorbed into your teeth as you swallow it, as well as being absorbed into your body from your stomach. It's best not to eat, drink, or rinse your mouth for 30 minutes after taking this product. To get the most benefit from Quflora, take it regularly at the same time each day. Avoid taking more than the prescribed dose. If you experience stomach upset, constipation, or nausea, it's important to let your doctor or pharmacist know. In some cases, excessive fluoride may cause mottled or stained teeth, so be sure to inform your dentist or doctor if this occurs. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. While serious side effects are rare, it's crucial to seek immediate medical help if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's also important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Quflora, it's important to discuss with your doctor or pharmacist if you have any allergies to its ingredients or other medications. It's also important to share your medical history with your healthcare provider before taking this medication. If you are pregnant or breastfeeding, be sure to consult with your doctor before using Quflora. This medication may pass into breast milk, so it's essential to seek medical advice before breastfeeding while using Quflora. Before taking Quflora, it's important to be aware of any potential drug interactions. This is because interactions with other medications can change how Quflora works or increase the risk of serious side effects. It's always a good idea to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. This includes both prescription and non-prescription drugs. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. It's best to consult with your healthcare provider before making any changes to your medication regimen. If you suspect someone has taken too much Quflora and they are experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the US, you can call 911 or contact your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, and stomach pain. Always seek help if you suspect an overdose. Remember, it's important not to share Quflora with others. It's also essential to remember that Quflora is not a replacement for a healthy diet. It's always best to get your essential vitamins from the food you eat, so maintaining a balanced diet is crucial. If you're concerned about the fluoride content in your water, you can check with your local town or city officials. If the fluoride content in your water supply is greater than 0.6 parts per million, you may not need fluoride supplements. However, if there are any changes to your water supply, it's best to consult with your doctor or dentist to determine if you still need extra fluoride. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take double the dose to make up for the missed one. When storing Quflora, make sure to keep it at room temperature and away from heat and moisture. Use the original plastic container to store the drops and avoid storing it in the bathroom. It's important to keep all medications out of reach of children and pets. Do not dispose of Quflora by flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. When the product expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.